Hi, this is Sarah Mikesell with the Poultry Site, and today we're here with Dr. Kalen Cookson. He is the Director Clinical Research at Zoetis Poultry. Thanks for being with us today, Kalen.
Good to be here.
Very good, and we're here today at IPPE in Atlanta, and it's great to be back with everybody here. There's a really good audience here for sure today, so it's nice to be back in person again for the second year. So today we're going to talk about recombinant HVT IBD with Kalen. So Kalen, let's dive into our questions here. Why have recombinant IBD vaccines become so popular in broilers?
Well, the simplest answer is because they work. They're the most effective, what I call cushion, to cushion against IBD infection and the losses or immune suppression from infections that we have that we can apply in the hatchery. And they not only help cushion early when maternal antibodies are starting to wane, but their duration of immunity is very solid too. So once you have immunity, it's basically for the life of the broiler.
Very good. Why is the AL2 virus used in so many IBD challenge studies today?
That is mainly because it's still the most predominant variant type that we have in the United States, and it has been for probably the last 2 decades. So it's the most relevant virus. It covers most geographies in the United States where people are raising broilers.
Very good. Excellent. And broiler progeny challenge studies are often conducted at 2 weeks of age. Why is that?
Well, that goes back to the immunity that we're trying to provide and the IBD effect based on timing of the infection. So if you have an IBD infection by 2 weeks or sooner, we're very confident that flock is going to suffer from immune suppression. And so that's the single most crucial goal that we have in broilers is to get them past that 2-week window that's most damaging.
Very good. Excellent. And what is the biggest take-home message from the study you presented at the Scientific Forum today here at the conference?
Well, last year I explained at today's presentation that last year we presented data where we had done our AL2 challenges at 18 to 19 days of age. And so we wanted to look on both sides of those windows and see what kind of protection we would see from that with the same AL2 challenge. Because when we presented that data to customers last year, they still had questions about, well, what about around 2 weeks and what about later? Because, you know, my maternal immunity program in my breeders is pretty good. We think we're getting protection out to 3 weeks or later. So, you know, what type of effect can these vaccines have when that challenge is out later?
Very good. It's kind of ensuring those gaps, right? What are those gaps that there might exist, right?
Because by 25 days, even the best breeder program is not going to have any meaningful maternal immunity. So it's going to be all dependent on your active immune program, which is the vaccines you're giving in ovo.
Excellent. And why did you also challenge broilers at 25 days of age, and did this show anything different?
Well, besides, some customers saying, I feel like, 25 days is more when my birds are getting challenged. But with that comes the fact that there are, some people maybe don't believe that, there's benefit to providing protection out that late. Because we mentioned, what's important, the most important is the 2 weeks. But what we also know about IBDV is late infections often can cause a temporary level of immune suppression. It's not as profound, it's more modest, but it lasts maybe 7 to 10 days at most. But if you have other disease challenges that are occurring in that, say, 4-week window, it can still be quite significant on performance. And so we wanted to look at, what type of cushion we can provide from in ovo vaccination in that window as well.
Well, thank you so much for all the information today, Kalen. This was really informative.
You're welcome. Thank you.
Thanks. This is Sarah Mikesell with the Poultry Site.